So, the Clinical Grand Round is one of the premier events that occurs every year at the ECCMID. And it always has a very large audience, and it always has excellent feedback from those who attend the session. I'm Robert Reed, and I have been chairing the Clinical Grand Round for quite a long time. We started doing the Clinical Grand Round at the Prague ECCMID in, I think, 2009. And it was started after an Australian professor of infectious diseases, Lindsay Grayson, and I both proposed a version of the Infectious Disease Society of America's Grand Round session, except that we wanted to have a session in which the trainees, the fellows, took part. And the idea generally was that we would have fellows come along and present interesting cases, and we would try to create the atmosphere of a real ward round happening in a hospital, except that each case was like really novel and quite difficult to solve, with lots of interesting problems, and how you treat it and how you can investigate the patient properly. So that was the idea, and we tried it out, and we decided we would have 6 senior physicians on the panel, and the fellow would present the case. And lo and behold, it worked a treat first time. And we've done it roughly the same way ever since then. What happens is that we will select cases that are gathered from trainees throughout Europe who are members of ESCMID. And we will assess their abstracts, and we will select 6 or 7 of those cases every year to present to the 6 consultants or senior physicians on the panel. And we ask the panel members to split out into pairs and lead the discussion, the questioning of the fellow about each of these cases. The audience really enjoys it, because actually these cases often are cases that they may have come across in their own career and have had to come up with a differential diagnosis. And I think people enjoy it partly because they get a chance to see, well, what would I have done, or what would happen in my hospital? And they can see in real time the events being drawn out during the presentation of the case. It's exciting, partly because it's alive. The consultants, the physicians on the panel don't actually know what cases are about to be presented. We select the cases for the variety of the content and the interest. People just join in because they want to see difficult current problems being solved by the best physicians often in the world, because we select our panel members from across the whole globe, from Australia, the United States, Europe, and the Far East and Southern Asia. The Clinical Grand Round is actually done in association with the Infectious Disease Society of America. It's a jointly run session, so we always have US fellows presenting their cases, and we always have at least one panel member from the United States as well. We've had some great times over the years. I can remember some really very interesting cases where I was sure that the panel members were not going to get it. But I remember being let down quite a lot when one of the panel members made a diagnosis of babesiosis, even before we'd shown the blood film, just on the basis of the clinical presentation and the baseline hematology results. And it's always a bit embarrassing when the panel member gets it within the first 2 minutes. Usually, however, they do get foxed, and it takes them an awful long time to come to the solution. But we always get there in the end. And we always get very warm appreciation and feedback from the audience. So I encourage you very strongly to join in and take part in this year's clinical grand round. We've got a great selection of cases and some great panel members as well. So welcome. I look forward to joining you there.